Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And today I'm going to talk about frequent conditions patients list that do not help their disability claim. Now, it's important to understand the reason for Social Security consultative examinations. And before I go any further, I'd like to state that everything that I express are my own opinions based on my own study and experience, and not the opinions of the Social Security Administration or any other medical body. A consultative examination is a means for Social Security to get an independent evaluation of the patient's current medical condition. They're usually ordered when Social Security is unable to decide whether a person's disabled or not based on review of their medical records. Before examining a patient, Social Security sends me some medical records on them, which I review. However, they do not send me the entire medical records, which may be hundreds or even thousands of pages long. They generally send between 5 and 20 pages that summarize the patient's problems. I'm also provided with a list of the conditions which the patient claims is causing them to be disabled. What's important for people to understand is that in order to be found disabled, you have to have conditions that affect your ability to work. There are many conditions that can cause problems for patients but do not affect their ability to work. And just to recap, the significant work abilities Social Security wants determined for each patient are the abilities to sit, stand, walk, lift, carry, handle objects, speak, travel, understand, remember, concentrate, persist, interact socially, and adapt. Keep in mind that about half of those abilities are physical and the other half are psychological or mental. Social Security considers both physical problems and psychological problems in a disability evaluation, and many patients have both. It's important to keep in mind that medical conditions that don't affect one's ability to work will not help for a Social Security disability claim. So what are the common conditions that I see patients complaining of that don't help with their disability claim? Well, by and large, they're conditions that are asymptomatic. Asymptomatic is a medical term meaning that the problem doesn't cause symptoms, such as pain or difficulty with function, either physical or psychological. A good example is high blood pressure, or as we doctors call it, hypertension. Now, high blood pressure is a serious medical condition that can lead to very serious medical problems such as strokes and heart attacks and kidney failure. However, in almost all cases, high blood pressure has no symptoms at all, and therefore does not interfere with a person's ability to work. Another similar condition is type 2 diabetes. Again, type 2 diabetes is a serious medical condition that requires treatment and could lead to very serious complications, such as neuropathy, causing the hands, feet, and legs to go numb, or again, cause heart attacks. But by itself, type 2 diabetes rarely has any disabling symptoms. The condition I always get a kick out of when I see it listed, and I see it listed at least once every day I do Social Security disability exams, is erectile dysfunction, difficulty getting and maintaining an erection. That may be devastating for the patient, but there are very few jobs that require getting and maintaining an erection. So just leave that problem out of your list of disabling conditions. Another condition that can result in very serious complications but has no symptoms by itself is hyperlipidemia, commonly known as high cholesterol. There are two viral infections which I often see listed, which may or may not contribute to a disability claim. The first is hepatitis C. Most people with hepatitis C have no symptoms. They do not feel sick. And in that case, a hepatitis C infection will not help your disability claim. Some people, a minority, get serious liver disease and even liver failure. And if you have liver failure due to hepatitis C, that is definitely a disabling condition. But plain asymptomatic hepatitis C infection is not a disabling condition. Similarly, HIV infection, the human immunodeficiency virus. These days, thanks to highly effective antiviral therapy, the majority of people infected with the HIV virus have no or minimal symptoms, and therefore that does not contribute to a disability claim. People who do have serious symptoms as a result of HIV infection generally have AIDS, the acquired immunodeficiency syndrome, and that, per Social Security, guarantees an effective disability claim. However, asymptomatic HIV infection does not. A condition I frequently see listed is GERD, or gastroesophageal reflux disease, commonly known as heartburn. Although this can be quite unpleasant, Social Security does not consider it disabling. The same thing with insomnia. You will not win a disability claim by adding insomnia to your list of problems. Something that I see very commonly is old, completely healed injuries. If you've had a laceration or a bone fracture or a burn several years ago and it's completely healed, you will not be found disabled based on that fact alone. Now, there are some injuries that do not heal well. For example, bone fractures that go through a joint commonly cause arthritis, what we call post-traumatic arthritis, several years after the fracture, and that can be disabling. But a bone fracture, burn, or laceration that is completely healed very well with no arthritis, no other problems, is not a disabling condition. Now I'm going to finish up with some conditions that may or may not help a disability claim. The first one I'm going to talk about is obesity. Social Security used to consider severe obesity, what we call morbid obesity, a disabling condition. But they've changed their mind and they no longer will find a person disabled based on their obesity, no matter how obese they are. However, obesity frequently contributes to conditions that Social Security does consider, such as arthritis in the knees and hips. So if you have those sorts of conditions, be sure to let the doctor know and list them. Knee and hip and ankle arthritis will interfere with a person's ability to stand and walk, and those are significant factors in a Social Security disability claim. Headache is a tricky one. Most people who tell me they have migraine headaches do not. They have simple tension headaches. And if you're going to claim disability based on migraine headaches, I'd suggest you look at the characteristics of migraine in a source such as Wikipedia or WebMD. Social Security will not grant a disability claim on the basis of tension headaches. And I'd like to add that if you have headaches every day or almost every day, year in, year out, those are not migraine headaches. Obstructive sleep apnea is another condition I see listed a lot. And by itself, it does not contribute to a disability claim. However, some people with obstructive sleep apnea have what's known as daytime sleepiness, which is they have such bad sleep at night due to their sleep apnea that they're very sleepy and prone to falling asleep during the day. For example, some of these people lose their ability to drive because they fall asleep at the wheel. Obstructive sleep apnea by itself is not a disabling condition, but if there's daytime sleepiness, that is a disabling condition, and be sure to mention it. Another condition is hernias. Many hernias are asymptomatic. That is, they don't cause the patient any problems, and in that case, again, they are not disabling. However, some hernias are painful. Some hernias interfere with movement, and if that's the case, be sure to let the doctor know. Finally, I'd like to talk about MRI findings. Some days when I'm doing Social Security disability exams, I wish the magnetic resonance imaging machine had never been invented, because patients will talk on and on and on about what's on their MRI without ever telling me what sort of trouble they experience from their neck or back. Just as spinal surgeons don't operate on MRIs, they operate on patients with symptoms. Social Security doesn't grant disability based on MRIs. They grant disability based on patients' symptoms and exam findings. They may use the MRI to support those symptoms and exam findings, but MRI findings by themselves give a doctor and Social Security no clue as to what sort of trouble a patient has with their neck or back. I want to know, does your neck or back hurt? Do you have trouble moving it? If so, in what way do you have trouble moving it? Are there things that make it worse, such as heavy lifting or bending over? None of those things can be deduced from whatever is on your MRI. One more thing I'd like to add. Many patients add anxiety and or depression to their list of disabling conditions. And by itself, that's not very helpful. Everyone experiences some anxiety and some depression during their life. For example, I once came face to face with an adult male lion, and there was no barrier between me and the lion. I was anxious. However, luckily, it turned out it was a tame lion, and I was able to get away safely. For a condition such as anxiety or depression to contribute to a disability claim, it has to be fairly severe and interfere with the ability to work. I'll give you one example. The last day I did Social Security disability exams, I had a woman who was almost paralyzed with anxiety to the extent that she had very great difficulty telling me about her problems and sobbed through most of the half-hour exam. Now that's serious disabling anxiety, and that's what I put in my report to Social Security. If you have serious disabling anxiety or depression, it helps if you can give some examples. For example, I've had some patients tell me that they have to have family members or friends do their grocery shopping because they get so much anxiety if they leave the house that it's unbearable. Again, that's a good example of disabling anxiety. Well, I hope this has been helpful, and always remember, if it happens, it's possible.